on the podium.
Good afternoon, everyone. My name is Anita David, and I am honored to be here with you today to speak about my journey from lying in a hospital bed to immersing myself in the medical system as a patient collaborator. So I guess I'm going to start off by telling you that I was a lively communications woman, wrapped up in my career, and I loved going out on the town and socializing. And people that knew me thought I was fun and vibrant and bubbly and up for anything. What they didn't know that was underneath the surface, I was in a constant moment-by-moment battle with my mental health. That is my mental health. That monster is what I deal with every single day. And at one point, that monster got the better of me. I was so tired. I lost jobs. I pushed away family members. I pushed away friends. I didn't leave my house. And then it all fell apart. I lost my battle with the monsters, and I had a plan. I was going to check myself into the Hotel Vancouver and get one of those rooms with a soaker tub, and I was going to wash down a whole bunch of pills I supported with a magnum of champagne. Luckily, a friend intervened, and I ended up in the hospital. While I was there, I was trying to figure out who I was, where I went from there, and deal with all my suffering. What ended up happening was I got released from hospital, and my hopes were dashed when I found out I had 14 tumors on my liver. 2 were at risk of bursting. The doctor told me that if I did not go in and get surgery, and one of those burst, I would die on the spot. So I ended up going for surgery, but it didn't go very well. I bled out on the operating table. I ended up in a coma and an ICU. And when they finally got in to do the job, I went home, and within 24 hours, I was back at the hospital with a mysterious infection. I spent another 3 weeks in isolation. And at that point, my whole existence was shattered. I felt so completely broken, and I didn't really know where to go from there. And it took time to process everything. What ended up happening for me was I started losing that detail, the day-by-day detail. But what remained with me was the moments, the good and bad moments. Those stayed burned into my psyche. And I was trying to figure out, what do I do with this? And then I found out I could be a patient collaborator. And by being a patient collaborator, I could help influence the system for patient care, and I could heal myself. And that's what I did. One of the first committees that I was on was creating a culture of safety in the psychiatric units. And everybody was concerned about physical safety, taking the patient's shoelaces, that kind of thing. But what I wanted to bring to the conversation was personal dignity. And I had many examples of my experiences and things I observed to that extent. So since 2017, I have been on 10 committees. I have been on 10 committees as a patient collaborator. And I really enjoy it. I find that it drives me forward. And one of the things that has helped me participate on the research project I've been involved in is that I had a chance to learn how to do community-based training, community-based research training. And that came out of a research project called Imagine Inclusion. And it's all about empowering peers through skills. So after I did the training, I was hired onto that project. After I was hired onto the project, I discovered that I loved working with my peers. I loved working with them one-on-one. I loved facilitating groups.